Well, you hope you never need it, but you are no doubt grateful when you do. MetroHealth Medical Center's Lifeflight helicopter.
The program is celebrating 30 years this month. Senior health correspondent Monica Robbins takes us up and inside this flying emergency room.
Rotor area clear. Rotor area clear right. Clear left. At first engine start. Roger.
It's just another day at the office for Metro's Lifeflight crew.
It's just, it's exciting. We all are a bit of adrenaline junkies. Keeps our job interesting.
Dr. Craig Bates practices medicine in an emergency room 1,000 feet up. He and flight nurse Amy Armbruster don't have much room to work in, but inside this helicopter is every high-tech device and medication they need.
Most of the stuff that we might use in the first, say, 30 minutes, except for x-rays and CAT scans, we can do in here.
Metro's Lifeflight is one of few in the country where a nurse, physician, and 2 pilots are standard. Everyone with equal say on the mission. 4 to go, 1 to say no.
You got to make good decisions, and the best way to avoid incidents and things going wrong with patients or with aviation is just to have a good safety culture and focus on the risk and do what you can to mitigate it.
The 3 Lifeflight helicopters are no longer based at the hospital.
We are clear.
Home is at Lorain, Wayne, and Portage County airports.
And it means that they're never more than, minutes away from getting, level 1 trauma care. There's 0.92. Okay, a few bumps coming up.
Surprisingly, they say this isn't a high-stress atmosphere.
It's just the 2 of us taking care of 1 or maybe 2 patients, so it's time to focus just on patient care.
We see people at their worst and see some horrific things. But like I said, sometimes we can see those patients come back and go home, and that's wonderful.
And the pilots do more than fly. They assist the medical crew as well. And while they know where they're going, they're not told what's waiting for them.
So the weather decision can be a very difficult decision on whether to go or not. And what they don't want is, they don't want that decision tainted by us worrying about the patients.
The Lifeflight helicopters are now EC-145s, equipped with the latest aviation safety equipment. And while it may be the most public image of MetroHealth, behind the scenes and on the ground, the team spends their time educating the community, including rescuers they're going to meet on some of those scenes.
That is fascinating. It really is. Can any doctor or nurse sign up to be a part of this team?
They would like to say it's pretty much cream of the crop. I mean, these people are specially trained in emergency medicine, and they go through additional training as well, and they are pretty much handpicked for this program.
And as you said, just fascinating, especially that they're not told what the patient's condition is before they get there.
Correct. The pilots don't know. The medical team does have that information, but the pilots don't know that information. It's to stop something what they call white knight syndrome, so they don't fly in a dangerous condition.
Makes sense.
Very interesting. All right. Thank you, Monica.